You brush your teeth, or maybe you forget. You think, what's the worst that could happen? Cavities, bad breath? What if I told you maggots could be eating your tongue right now? You won't believe what's lurking in the mouth. Tongue and gumworm invasion. In a small village clinic, a man walked in with a swollen jaw, unbearable mouth pain, and a foul stench no one in the room could ignore. Doctors thought it was a rotten tooth, until they looked closer. And what they saw shocked even seasoned professionals. Between the gums and under the tongue, tiny white larvae were squirming, feeding off decaying flesh. It was a case of oral myiasis, an infestation of flesh-eating maggots inside the human mouth. Oral myiasis is a rare but horrifying condition caused by the larvae of flies, often from the Calliphoridae or blowfly family. These flies are attracted to open wounds, especially in unhygienic conditions. In tropical and subtropical regions, especially where access to dental care is limited, these infestations are more common. But here's the terrifying part. You don't have to be in a jungle to become a host. There are several terrifying ways oral maggots can get in. A fly lands on your open mouth while you sleep and lays eggs. Eggs are deposited near an infected gum or decaying tooth. Open sores, ulcers, or oral surgery wounds become breeding grounds. In just a day, these eggs hatch and begin feasting, not just on decaying flesh, but sometimes on living tissue too. Let's take a look at some shocking real-life cases of tongue and gumworm invasions. Case number 1, India, 58-year-old male. Presented with extreme swelling, pain, and halitosis. Upon examination, over 50 maggots were discovered burrowed deep into the tongue and upper gum line. Case number 2, Brazil. An elderly female with dementia was left untreated for oral ulcers. Flies laid eggs in her lower gums. The maggots penetrated the soft tissue, causing a severe infection. Case number 3, a child in rural Pakistan. He had been playing outside and sustained a gum injury. Within 3 days, the child was in emergency care due to visible larvae emerging from his gums. How can you tell if your mouth has become a breeding ground for these invaders? If you experience any of these symptoms, seek immediate medical attention, because every hour counts, as these maggots grow fast. A crawling sensation in the mouth or jaw, swelling of the gums or tongue, severe halitosis or a rotting smell, pain or bleeding when eating or brushing, visible white worms in wounds or ulcers. Treatment for oral myiasis involves mechanical removal of each maggot. Doctors use forceps or suction to pull them out, sometimes dozens at a time. In some cases, doctors apply turpentine oil or chloroform to suffocate the larvae, making them easier to extract. Antibiotics follow to treat secondary infections, and in severe cases, surgical removal of damaged tissue may be necessary. Why does this even happen in the first place? The scary truth? Even a simple cavity left untreated can become an open invitation to flies and their flesh-eating offspring. This may sound extreme, but trust me, once you've seen maggots in someone's mouth, you'll never skip brushing again. Your mouth is the gateway to your body. Keep it clean, keep it closed. Because the next time a fly buzzes near your lips, it might just be laying the seeds of a living nightmare. Subscribe for more shocking medical stories and share this to warn someone who always forgets to brush.